Living with chronic pain can feel like having a full-time job, except this job comes with no manual, no training, and sometimes it seems like your supervisors, aka your doctors, are speaking a different language. If you've ever left a doctor's appointment feeling unheard, confused, or frustrated, you're not alone. I'm here to provide the information you can rely on to become your own best advocate and get the care you deserve. Greetings. It's great to see you again. And to those who are here for the first time, you are very welcome. Before we dive in, let me share something with you. Every single day, I hear from people coping with chronic pain, complaining of their struggle to communicate effectively with their healthcare providers. But I've seen firsthand in my work as a pain relief practitioner how the right approach can transform a doctor's visit from frustrating to empowering. In the next few minutes, I'm going to give you the exact tools you need to make this happen. The key to a successful medical appointment starts long before you walk through the doctor's office door. Let's talk about how to prepare effectively. It's important to start a pain diary at least 2 weeks before your appointment. You should note the intensity of your pain on a scale of 0 to 10 and what makes it better or worse, how it affects your daily activities, any patterns you notice, side effects from current medications. It's important to create a clear, concise timeline of your pain journey by including when did the pain start, previous treatments and their effectiveness, any relevant injuries or medical conditions, and family history that might be important. Now, here's something many patients overlook, but it's absolutely crucial for getting the most out of your appointments, and that is to bring support. You can ask a friend or family member to accompany you to in-person appointments. They can take detailed notes while you focus on communicating with your doctor. They can help remember important points you might forget. They can provide additional perspective about how your pain affects daily life. Having an advocate present often leads to better outcomes. These days, healthcare comes in many different forms. Whether you're seeing your doctor in person or through a screen, here's how to make each type of appointment work for you. For the in-person visits, it's important to arrive 15 minutes early for paperwork. Bring your pain diary and medication list. Have your support person ready with a notebook. Bring a list of questions. So that's what you're going to do for in-person. But what if your appointment is virtual? Don't worry. Telemedicine can be just as effective when you know how to prepare. For telemedicine appointments, first test your technology beforehand. Find a quiet, well-lit space. Have your pain diary and medication list ready. Consider having your support person join virtually. Keep your camera at eye level. Wear appropriate clothing as you would for an in-person visit. And have a backup phone number ready in case technical issues exist. Now that you're prepared for either visit, let's talk about making the most of your actual time with your healthcare provider. During your appointment, it's important to remember the 3 C's: clear, concise, complete. You need to describe your pain using specific terms. Is it sharp, dull, burning, or throbbing? Does it radiate to other areas? What time of the day is it worse? What activities become impossible? Once you've described your pain clearly, it's time to get the answers you need. Here are the questions you should never leave without asking. The first one: what is the diagnosis and what caused it? What are all my treatment options? What are the risks and benefits of each option? What lifestyle changes could help? What's our plan if this treatment doesn't work? Before you wrap up your appointment, there's a crucial checklist you need to complete. Don't leave until you understand your treatment plan, how to take any medications, what side effects to watch for, when to call the office, and what improvements to expect and when. So the appointment might be over, but your work isn't quite done yet. It's important to create an after-appointment action plan. You should review your notes with your support person. Write down everything you remember immediately after. Set up a system to track your progress. Schedule follow-up appointments as recommended. Know who to contact if you have questions. Many patients worry about being labeled difficult if they ask too many questions. But it's important to remember, good healthcare providers want engaged patients. You're not being difficult. You're being proactive about your health. And remember, you've now got all the tools you need to be your own best advocate. Living with chronic pain is challenging enough. Getting proper care shouldn't add to your burden. Please try to use these strategies to become a stronger advocate for yourself. Your pain is real, your concerns matter, and you deserve to be heard. So it's bye for now, and I'm wishing you a comfortable week.